Hi, Tim Russell here for Inovera Bioscience, 4-Via vitamins, and 4Bones with Extra D calcium tablets. A lot of you watching may know treatments for inflammatory bowel disease can include biologic agents like Remicade and Humira. These biologics can increase the susceptibility to infections because they reduce the body's immune response to infecting bacteria. One of the serious bacterial infections is TB, or tuberculosis. In looking for a topic for this week's video, I found a Center for Disease Control fact sheet on tuberculosis on the cdc.gov website. Tuberculosis is an infection of concern when considering biologic treatment because someone who's had tuberculosis could have a resurgence of the disease. I also learned there's a condition called latent tuberculosis, where a person could be exposed to tuberculosis but not actually become sick. They do not have symptoms. Chest x-rays or sputum tests are negative. They also cannot pass the bacteria on to other people. However, the tuberculosis bacteria are still in their bodies and could emerge later if the body's immune system becomes compromised. Because biologics for IBD do affect the immune system, they shouldn't be given where TB is present. Now, there are skin tests for TB that will detect latent TB, called the Mantoux test and the older Tyne test. And while the chances of having latent TB are fairly low for most people in the U.S., there are countries where TB is much more common. Travel or residence in these countries can increase the chances of TB exposure. The tbfacts.org website lists these high-burden countries, which are primarily African and Asian locations. If you're discussing biologic therapy with your doctor, you may wish to ask about a skin test, especially if you have spent time outside the U.S. in Africa or Asia, or have been in contact with anyone known to have TB. If you do test positive for latent TB, you will need to be treated with antibiotics before starting a biologic. That could delay starting treatment for up to 6 months while you're treated for the TB. So, thanks for watching.